Hi everyone, I'm Hartford HealthCare's Tina Verona. Thank you so much for joining us for this live Facebook discussion with the Hartford Courant. We're talking about a delicate topic today, what to do if you discover your aging parents need help. Where do you turn? Well, here with me is Nancy Becker from Hartford HealthCare Center for Healthy Aging to answer all of your questions. Nancy, such a pleasure to have you here. Thank you for being here with us.
Well, thank you for having me.
So we're coming on almost to the end of October now. Holidays are approaching, I can't believe it. But many folks will be coming home for the holidays, seeing their parents for the first time, maybe perhaps in months. And maybe they notice some subtle changes. What should they be looking for that you might think might not be right?
Definitely. So you want to look for something that's unusual or maybe out of the ordinary for your parent. Things like the mail stacking up, maybe bills that aren't paid, mail that's unopened. You might also want to look at their physical appearance. Are things changing? Maybe mom was always someone who had her hair done on Fridays and that's not happening anymore. Or dad used to shave every time before company came over and you're noticing he's looking a little disheveled. Another good place to look at is the car. Are there dings? Are there dents? So maybe driving's becoming an issue. All of those are good warning signs that something might be happening and it's time to have a conversation.
And how do you have that conversation with them? Because that's often difficult. You know, elderly parents, they want to keep their independence for as long as they can. So how do you even broach that topic with them? How do you start the conversation?
Difficult questions you're having me answer. So you really, there's really no one size fits all approach for having this conversation, but it's important to have some of the things that can make it more successful is by letting your aging parent know that you're there as a support and that they're still in control, that you know independence is really important for them and you want to make sure they can continue to do that. You want to look into resources, maybe have some information ready for them. If that does not work, which it may not work for everyone, is there a trusted friend, neighbor, maybe a physician who can start that conversation? Somebody that your parent really trusts and is comfortable talking with these things about.
What if it's a subtle change, like, you know, maybe your mom lost some weight and that's really the only change you see and she says, no, I'm just fine, but you think there might be a little more. Do you continue to, do you still have that conversation with her, or do you call somebody? What do you do?
Absolutely. So no matter how small the change might seem, you really want to have that conversation because it could be attributed to a lot of different things. It might be something really small and treatable, but it could be something much more serious. So even if it seems small, you definitely want to have that conversation with your parent and then talking with their physician as well.
And now let's talk about that. You offer a plethora of services, Hartford HealthCare Senior Services. There's so much for really tailor-made to whatever you specifically need. There's free home health care assessments. Let's start with that first. What does that entail?
Absolutely. So the Center for Healthy Aging offers free assessments. We go into the home, we can meet with folks in the hospital or other locations if needed. And our goal is really to find out, are there any gaps in their current care? And what is their plan? Is it to stay in their own home? Is it to look for other housing? And we'll make recommendations based on what their specific needs are. So is it connecting them with health and fitness programs? So like the Good Life Fitness Exercise Program, outpatient rehab. If it's just needing a little extra help at home, is it the caregivers through Hartford HealthCare? Somebody who can help with laundry, cooking, personal care, maybe the Lifeline button that you wear around your neck or on your wrist. There's also the electronic medication dispenser, which is huge to keep making sure people are taking their medications at the right time each day. Sometimes the home is no longer the best option though, and Hartford HealthCare offers skilled nursing facilities as well as assisted living communities.
So how can folks prepare for that if they feel like, you know what, I probably could really use a home assessment for my elderly parents? What do they need to know before they make that call?
So luckily you don't need to know anything other than you're not sure what to ask or where to go. So the phone number will be listed, I think, up for everyone to see. You can call the Center for Healthy Aging and let us know that you're concerned about a loved one or maybe yourself and you're just looking for information.
And you know, I think that's important to stress, is that they really don't need to know anything before going into this, because you guys take care of it all and you're so methodical and specific about the services, and it's really tailor-made to whatever you need. Like you said, it could be whether they want to stay at the home or whether they need a skilled nursing facility. You guys handle all of that, which I think is such a huge burden and relief off of adult children. Do you find that?
Absolutely. A lot of times the adult children are dealing with so many things. They're working full time, they're taking care of children.
Right.
So how are they going to manage all of those things? The Center for Healthy Aging will make sure that you're aware of all of the options, things you probably haven't even heard of and don't know exist. We also have a geriatric care manager that I really recommend. So she is somebody who takes over coordinating the services. She advocates for mom or dad, goes to doctor's appointments. So it's really just another set of hands for that adult child who can't be everywhere and at all times.
Yeah, and that's important, I think, too, because you talk about that sandwich generation where you've got the adult children taking care of their children, and now they're taking care of their parents as well.
Right.
So that's a huge burden lifted, that you sort of have this advocate working on behalf of elderly parents when you can't always be there, or if you live out of state.
Right.
What do you find in terms of adult children and their aging parents? Do you find that it's almost just as difficult for them too? What sort of resources do you have for adult children who may be going through this with their elderly parents?
Right, it's really that role reversal where you're trying to take care of your parent, and that's uncomfortable sometimes. But there is a lot of support out there. The adult children are really the glue that's holding together their families. So we need to make sure that they're getting the support they need. We recommend support groups, some of the educational series that are available in the community, and just letting them know what information is out there. So the geriatric care manager, hiring in-home caregivers. Who else can be there when they can't?
We do have a question from Samantha on Facebook. She asks, what is the difference between home health care, hospice, and personal care?
Well, hello, Samantha. Thanks for asking the question. So home health care refers to skilled nursing visits. So that would be nursing, physical therapy, occupational therapy, maybe a home health aide to come in. And that's usually after somebody's had a hospitalization or some new medical change. A lot of times something major has happened and it's just a temporary service though. So it's important to remember that they're only going to be coming out for a few weeks. When we talk about hospice and also palliative care, that is when somebody has a chronic health condition, maybe something with their heart, their lungs, and they're needing symptom management. So that really focuses on keeping people comfortable. And hospice is end-of-life care. It can take place in nursing homes, hospitals, and even in your own home, but that's really an end-of-life care. And that's something that we could talk with families about, but we also recommend speaking with your physician as well.
It really runs the gamut.
Yeah.
In whatever stage you may be at that particular point in life, you have something for that, which I think is so critical. Another question from Rebecca on Facebook: how is a caregiver selected? How involved can I or my loved one be involved in the process?
Great, thank you, Rebecca. So caregivers are selected a few different ways. It depends on what agency you go through. So Hartford HealthCare has agency Independence at Home, and those caregivers are all nationally background checked. We look at what type of certifications they have. So maybe are they a CNA, like a certified nurse's aide? And we're also looking at what trainings do they have. If they're working with older adults, do they understand dementia, different disease processes? And we always make sure that folks go out to meet before they start. We want to make sure it's the right fit for that family. And if it's not, if a caregiver goes out and it doesn't seem to be working, you talk with the agency about finding someone else. So you should be very involved.
Yeah, I was going to ask you, because that's such a critical part of the process, is just selecting that right person, because that is such an important role, because they're sort of the eyes and ears. And are you in direct contact? Does the adult child stay in direct contact with that caregiver? And how often, and how does that work? How does the communication work?
Great question. So they should be. The adult child can be as involved as you want. I have families I see that the adult child's there when the caregiver is there, at least for the first few times when you're building that relationship and you're making sure that they understand what the expectations are. But you can check in, whether it's a phone call, a surprise drop-in visit. They also have supervisors from the agency that go out to make sure that everything is going well too. So it's not all on the adult child to make sure. There are other safety nets.
Safety nets. Okay, we have another question from Laura on Facebook. She asks, what steps need to be taken when making someone a healthcare proxy?
Great question, Laura. So a healthcare proxy, also known as a healthcare representative, is somebody who can make the decisions for you when you are unable to speak for yourself. So that needs to be something that you're discussing right now, something that we should be discussing at any age. So you want to make sure you're thinking about who is somebody that you trust that knows your wishes and will make sure that those are followed through on if you can't speak for yourself. There are forms, you can get them online, but the hospitals usually have them as well. They just need to be completed and notarized, and then you bring them to your doctors.
And it's having those courageous conversations that's really difficult to start even that process. Nobody wants to think about that. How do you suggest you even start to have that conversation, or how do you even do it?
Yep. So those are the difficult things, and we hear this all the time at Hartford HealthCare. Where do we begin? Again, it's being a listening ear for your parent, finding out what their wishes are, letting them know that they're in control and you just want to support them, and see where they want. So don't try to jump in with your concerns, but maybe just say, I want to hear from you, Mom. What are your challenges on a day-to-day basis, and how can I help you in that? And just see where the conversation goes.
And I bet in a lot of instances you have people, maybe it was a little rough start in getting somebody in the home, but I bet after that happens and there's a real comfort level and that trust factor has really been established, I bet they find that, I'm glad that I have this.
Absolutely. It becomes kind of a friend almost, someone that they trust, they count on. A lot of times we find that older adults are really isolated in their homes. They're not getting out as much, so having that caregiver in there is socialization and helping them remain independent.
Samantha has a follow-up question. How is the schedule determined with the caregiver? Can these schedules be adjusted easily?
Great question, Samantha. So the schedule is determined on what that individual needs. It's all about you and what you need. So is it that you need someone in the morning, or are you more of an afternoon person? Caregivers can be anywhere from 3 hours a day to 24-hour care, so it really is tailored to that individual. Schedules can be adjusted, but if you want to keep the same caregiver, they may have other folks that they're seeing throughout the day. So it's working with the agency to make sure that happens.
And another question from Rebecca, will my parents always have the same caregiver?
So that's the goal, is that consistency. You have that trust and that relationship. You don't want to see other faces coming in. So as long as we keep a set schedule, you should be able to have the same caregiver each time.
We are talking with Nancy Becker from Hartford HealthCare Senior Services. We've gotten some great questions from all of you on Facebook. Keep them coming while she's here. We know that this is sort of a difficult topic to broach with elderly parents, but certainly an important topic. A comment from Facebook. Yvette says, thank you very much for sharing this important info. So helpful to have this information and resources available. Well, thank you, Yvette, for watching and tuning in. If you do have a question, feel free to ask it. What would you suggest to somebody who might just be sort of starting out and they don't know where to begin? What do you suggest that they do?
Yeah, so being proactive is a really important thing. So well before you need assistance, that's when we want you to be reaching out to us. So if you're sitting there listening and you're thinking, oh, I'm doing just fine, this is the time to call. We want you to be proactive, because the earlier you start asking questions, the more control you'll have and the more options will be available to you. If we wait until a medical condition or a crisis, there'll be a lot fewer things that we can do.
Right, right. We're talking about healthcare from a different angle. There are hospitals, but healthcare of the future is really keeping people at home. And how can we keep them at home? That is their comfort zone, after all.
Yeah, most people want to age in place. They want to stay in their own home. So there's a lot of services. We have visiting nurse services, telemonitoring, in-home caregivers, assistive technology like the Lifeline button and the electronic medication dispenser. There's home modifications. I could literally go on and on.
Well, let's talk about telehealth too, because we hear a lot about that, and that's really sort of bursting onto the scene, if you will. Tell us how that works and what they can expect from that.
Right, so there's telemonitoring, telehealth. It's really having technology in your home that helps track how your health systems are doing. So it will track what's your current weight. If you're monitoring that, maybe you have heart failure. It's looking at what is your blood pressure, your blood sugar, and there is a system connected to that. So if any of your numbers are seeming a little bit off, there's a nurse or a physician that's looking at that and knows right away that we need to get this person into the doctor's office. So it's really catching things before they become a major problem.
And the Lifeline, obviously, if you hit that button, what happens?
Yes, so the Lifeline is great. It actually comes with a service. So the person behind the Lifeline has a list of your medications, your allergies, who your primary contact is. So when you press that button, someone's coming on and saying, Mrs. Smith, are you okay? And if you're not able to respond, they call not only your emergency contact, but also the ambulance. But we do hear a lot of people often say, oh, my cat walked over it, I accidentally pressed it. That's okay too.
Right. Right.
You know, don't be afraid to press it.
Absolutely. Another question from Samantha on Facebook. What is the Philips Lifeline Medical Alert Service?
Yes, so the Lifeline is another term for emergency medical response system. So it's that necklace you wear or the pendant around your wrist. So it's the same thing, Samantha.
Question from Andrea. Does Hartford HealthCare provide all these services you have mentioned, and how do I get them? Thanks, Andrea, for the question.
Yes, Hartford HealthCare does provide all of these, Andrea. So if you want to contact the Center for Healthy Aging, and the phone number will be up at the end, you can call and have an assessment with us, and we can talk with you about all of the different services and what might meet your needs or your aging parents' needs, because we want to tailor the services to you and not just look at all of them.
I want to circle back to the medication assisted program too, because I think that's so vital. A lot of times you find, I'm sure, that there are expired medications in medicine cabinets. Talk to me about what you find, and I'm sure it's always surprising to find that.
Yes, so we do a lot of data collection also, and about 80% of the time we go out, we find that there's medication errors, that somebody's taking expired medications, not the right dose, maybe they're taking someone else's medications. So what we see is when we go out to the home, we say, show me your medications and how you take them. And we find that somebody brings out a basket. Maybe it's on top of the refrigerator, it's under the bed, it's in the bathroom. It's not just one place we're seeing medications. And people often forget that over-the-counter things like vitamins, those count. Those can all interact.
Right.
So you really want to make sure that you're showing, whether it's the nurse or us, somebody going to the home, showing them all of the things you take, even if you think it's harmless and completely natural.
Right, because that can be contributing factors to if they are going through something. It could be all of the conglomerate of medications that they're taking, which I think is so critical. And that's part of the home assessment, is that right?
Yep, absolutely.
Another question from Laura. What is the best way to handle the conversation if the adult, children, and parent don't agree on the plan of care? Thanks, Laura.
Yes, thank you, Laura. So I would say bringing somebody else into the conversation. It's difficult as the adult child to be kind of that role reversal, telling your parent what they need and what they need to do. So having somebody objective like the Center for Healthy Aging or a physician, somebody that they trust and respect, have that same conversation, it oftentimes comes across a little differently when it's not their child telling them what they feel is best. So bring in other people.
And like I said, it's really tailor-made for your specific needs, whatever it is you're looking for or whatever it is you might need. You might not know you need it. But this is a great service because you can, it's sort of like here, you take over, and that's essentially what you do.
Right.
And when you go through that evaluation process, when you do come out to them, what are you looking for when you do that? You're meeting with family, obviously. What are you looking for? Do you take a tour around the house to make sure there are no hazards? Tell us about that sort of evaluation process.
Definitely. So I like to start off by asking, what is the aging parent, what is their biggest goal? Because I do want to make sure that I'm focusing on what are their goals and wishes and not just pushing my agenda as the professional. But I do like to take a holistic approach. We talk about everything from finances, planning for the future, looking at the house, any fall risks, safety issues, home modifications that might help. And then we look at how they're functioning in the home. Are they able to get up and down the stairs? What does the laundry room look like? The medications, again, their health conditions. So we take a holistic approach, but I really like to focus on what is their biggest goal, because I don't want to talk about all these other services that they might not be ready to hear yet.
Right, right. And so I think it's important as folks come home for the holidays that they should be looking out for this stuff and kind of doing their own little home assessment too, right? There's kind of some things that you can look at right away and say, well, this might not be a good idea or this might not be right.
Exactly.
What are some of those things that sort of stand out that would be a real red flag to say this is not right?
So first thing, open the refrigerator in the pantries. Is there food in the refrigerator and pantries? Is it expired? Again, the medications, are those expired, or maybe they don't look like they've been taken? Is there a pill box that's completely empty? Looking at the house too, maybe mom or dad or somebody who really prided themselves on good housekeeping and the house is dirty or it just seems very unorganized. Anything that's unusual for your parent, because some of these things might be typical. This is how mom or dad always lived. You don't want to, those aren't always red flags.
Right.
But looking at the physical appearance, some more obvious things.
Right. And family members know their parents, obviously, so you know what to to look for. Question from somebody emailing a question in. How do children walk the fine line between respecting the wishes of an aging parent who wants to stay in their home versus making the decision, perhaps against their will, that it's time for them to make a living transition?
Great question. A very difficult one that we hear very often. So it's important to make sure that your aging parent still feels in control, because they are in control. It is their decision, it is their life, and you're just there to be a supporter. You want to let them know that you respect their wishes and that you want to help make sure that if they want to stay home, that they can. But in order to do that, maybe we need to bring in assistance. Trying things first. Don't jump to an assisted living or nursing home first. See if there are other things that can happen in the home.
And you know, this is something, it's not really something like if you have a caregiver come in to do the laundry, do everything, it doesn't always have to be that way. You can always switch things around if need be as you're going along. Well, maybe we need more of this and less of that. You can, there is that flexibility, is that correct?
Nothing is set in stone. Yep.
Okay, Betsy asks, do any insurance programs cover these costs for in-home care? That's a question I'm sure you get often.
Yes, finances. Thank you, Betsy. So finances, typically services are privately paid for. When we're talking about caregivers that are coming in on a long-term basis to help with cleaning and cooking, that's not covered by insurance. If you have long-term care insurance, it could be covered if your physician says it's needed. There are also veterans benefits, state programs, and grants. So meeting with the Center for Healthy Aging will help you find out what you're eligible for and what direction you need to go in.
And also, too, you are instrumental in taking a look at current insurance plans to see if maybe that is right. You know, a lot of times people don't look at their insurance coverage for many years and they just kind of stick with the same one, but you can actually assist and look at those insurance plans to say, you know, there may be a better plan out there for you, or you should stick with this. Is that right?
Right. So we are all choices counselors, so that means we can help with the Medicare open enrollment and even throughout the year. So right now we're encouraging people to look at their Medicare plans, sit down, meet with us. We look at your medication list and what's going on medically, and we can let you know what plan would fit your needs and also be the least expensive. We had somebody we met with, I think, a year ago that we saved them $11,000 per year just because they really loved the insurance plan they were on, but it wasn't covering half their medications.
Wow, that's incredible.
Huge.
So you actually look at their, and during this open enrollment period until December 7th, you actually look at their insurance coverage and discover what the best fit might be for them. That's very important. We have a question from Brooke. How will home healthcare technology continue to evolve to help ease the anxiety of children with aging parents? That's a great question. Thanks, Brooke.
Yeah. So, Brooke, it's very exciting to see technology and how people are embracing technology now. There's things like the Lifeline button we talked about and some of the other things, but there are monitors now. So maybe mom or dad still live at home and you need to check in, whether it's that you're at work during the day or you live far away, but there are monitors that you can check in into each room to see how things are going. There's wander guards, so you can see if they've left the house. Alarms would go off if it's somebody you're concerned about leaving. It's really exciting to see what's coming, but I think it's allowing people to remain home longer and just tap into resources right in their own home. Most people want to age in place.
Right, and I think, and like Brooke mentioned, to ease the anxiety of the adult child in this particular case is so huge. It's great all the way around. Mackenzie asks, when is the right time to take your parents' license away from them? How do you approach that conversation in a respectful way? Because this is, thanks Mackenzie, this is the key to your independence right there.
Yeah, absolutely.
That's a tough one.
Yes, and so I don't have an answer, a blanket answer for that, Mackenzie. It really is based on each person, but looking again at the car, are there dings or dents? Look at the garage, are there dings or dents on that? If there are accidents happening, certainly if there is some sort of diagnosis of dementia or some severe memory loss, those are all signs that it's time to take the license. For each person, it's going to be different. Is it the adult child? Is it the physician maybe who should have that conversation? Sometimes it's a police officer or the DMV. It really depends on what's happening and how severe it's gotten.
Yeah. We are talking with Nancy Becker. She's from the Center for Healthy Aging here at Hartford HealthCare. We've gotten some really great questions here today. Thank you so much for asking these questions. And when you can't be there, you can get care 24 hours. It really is tailored to that individual person, as we were talking about. And as you go along on this journey, you can always make modifications. So it's not that we don't want folks out there to feel like, well, we're going to have this person come in to do the laundry. It doesn't always have to be that way. As you go along, you can make those modifications. And how does that work? Are you in touch with them that whole time? Do you come in and reevaluate? Do you do another home assessment? What happens there?
Yep. So we try to stay in contact with everyone, whether it is the next week, the next month, or maybe 6 months down the road. But we really like to stay in contact because we know that aging is progressive and things are going to change and our needs are going to change. We do have families that constantly contact us, but we also want them to know that we'll reach out as needed too.
Right. And so the lines of communication are always open.
Yes.
So they can contact you whenever, which I think is so important. What advice do you have for folks out there watching us now who may be, whose elderly parents might be getting to that point? When do you start to have that conversation?
Yeah. Now. Right now.
At any age.
Yes.
Right?
Start planning way ahead. You're going to have a lot more options and be a lot more prepared and a lot less stressed if you've already had these conversations. Knowing what's available and having a plan will help relieve a lot of that burden and stress. Because then there won't be any guesswork when there's a crisis or emergency.
Right, and I think too that's important that you're not having this conversation when they're elderly and they're in their 80s, or then it's even more difficult because they're very stubborn, right?
It could be, very stubborn, or there's a lot of health conditions, or maybe they aren't able to communicate their wishes at that point if something medically has happened.
Right.
So.
Yeah, advanced directives too is another thing that's very important that I want to touch upon. Tell folks a little bit about what that is and what that means. We touched upon it, but what that specifically means.
So advanced directives are things like the power of attorney, healthcare representative, and also your living will. So the power of attorney is a financial document telling or assigning somebody who can handle your finances. So that might be who can go to the bank, pay your bills, talk to your insurance company. The healthcare representative is who's going to make medical decisions if you cannot. The important thing to remember is that these two documents do not override what the person wants. This is just somebody to help you and to kind of follow through on your wishes.
Right.
So they can't say, mom is saying this, but I'm going to go this way. That's not what its intention is. And the living will really recommends, do I want CPR, a feeding tube? What kind of life-saving measures do I or do I not want?
A donor.
Yes.
Yeah, and a lot of people may not be familiar with that term, advanced directives, but I just wanted to make sure that we touched upon that so they know in case you do hear that term. Rebecca asks, how do you handle or help the adult children the need for multiple caregivers with parents who are struggling with memory issues? This is often a very frightening situation for the parent to have relative strangers in their home. That's a great point.
Absolutely, Rebecca. So that's why it's important to find the right caregivers or the right agency. You really want to be making sure that the agency nationally background checks the caregivers coming out. Is there workman's comp? Are they bonded? What kind of training do these caregivers have? Have they gone through dementia and Alzheimer's training? Is there ongoing education that's available to them? It's going to be difficult to have other people in, but I think the more involved you are, getting to know these caregivers, setting up the schedule will help.
What type of credentials should you be looking for in a caregiver? What should they have that would qualify them to take care of a person? If they have somebody from another agency, let's say, what should they be looking for? What qualifications do they need to have?
Yeah, so you can talk right with the caregiver, but also ask the agency before they even send someone out. Do they have dementia training? Have they been through the Alzheimer's Whisperer program? Are they certified dementia practitioners? Just finding out what education the company does, as well as if there's anything on the resume of the caregiver they're sending out.
Right.
And if they're going to be doing any personal care, does this person have training as a home health aide or a personal care attendant? What kind of hands-on care have they given in the past?
And qualifications for folks here at Hartford HealthCare at Home Centers for Healthy Aging, they all go through sort of a rigorous background checks, and tell us a little bit about their qualifications.
Yeah, so they're all certified nurses aides, so that means that they know how to safely transfer folks, they have a medical background, they've all been nationally background checked. Like I said, the supervisors go out, they do spot checks, they call in, so there's a lot of oversight with these caregivers that we're sending out, because we know how scary it is to have strangers in your home.
Right, sure. And do you then make repeat visits as well? Do you
Yes.
actually go back out there and make sure everything's in check as well? And how often does that happen?
Yeah, so it's really, again, tailored to what your need is. So for some folks, it might be, again, in 6 months. Some people are doing really well and they call us again in a year or two, and then we'll go back out. The nice thing is we're located in a lot of the hospitals, so if somebody unfortunately is at the hospital or maybe they're at a doctor's appointment close by, we can pop in there too.
Yeah, so really anywhere that you can be, which I think is so vital. So really kind of the one takeaway message you have for folks out there as we head home for the holidays. This is your stage. What would you want to say to them?
I would say go with your gut. If you feel like something isn't right, if you're concerned about mom or dad, go with that. Call the Center for Healthy Aging. We'd be happy to come out in person, but really just listen to your gut, because you know mom or dad better than anyone else. So give us a call. We'd be happy to do a home visit and really discuss all of the options, because we want to come out before something happens. We want to make sure that you have all of the options and information in front of you so that you can really make the best decision for your family.
I think the takeaway message here too is really start now and be prepared. And communicate.
Yes.
Nancy Becker, thank you so much for
thank
joining
you.
us from the Center for Healthy Aging here at Hartford HealthCare. And of course, we thank you for joining us today as always. You can call 1-877-4-AGING and the number 1 for questions on aging, anything you want we didn't maybe cover here today, or for that free at-home risk assessment that we were talking about. So again, thanks for joining us today. I'm Hartford HealthCare's Tina Verona. We'll see you next time.